Factor Roman 12. Coagulation factor Roman 12, also known as Hageman factor, is a plasma protein. It is the zymogen form of factor XIIa, an enzyme EC3.4, 21.38 of the serine protease or serine endopeptidase class. In humans, factor Roman 12 is encoded by the F12 gene. Structure: human factor Roman 12 is 596 amino acids long and consists of two chains, the heavy chain 353 residues and light chain 243 residues held together by a disulfide bond. It is 80,000 Daltons. Its heavy chain contains two fibrontin type domains type I and Roman 2, two epidermal growth factor-like domains, a Kringle domain, and a proline-rich region, and its light chain contains the protease domain. The structure of the F and IEGF-like tandem domain of coagulation factor Roman 12 has been solved by X-ray crystallography. Crystal structures of the XII light chain has also been determined on bound BFCI and bound BFCA2 inhibitors. Function: factor Roman 12 is part of the coagulation cascade and activates factor Roman 11 and prekallikrein in vitro. Factor Roman 12 itself is activated to factor XIIa by negatively charged surfaces, such as glass. This is the starting point of the intrinsic pathway. Factor Roman 12 can also be used to start coagulation cascades in laboratory studies. In vivo, factor Roman 12 is activated by contact to polyanions. Activated platelets secrete inorganic polymers, polyphosphates. Contact to polyphosphates activates factor Roman 12 and initiates fibrin formation by the intrinsic pathway of coagulation with critical importance for thrombus formation. Targeting polyphosphates with phosphatases interfered with procoagulant activity of activated platelets and blocked platelet-induced thrombosis in mice. Addition of polyphosphates restored defective plasma clotting of Hermansky-Pudlak syndrome patients, indicating that the inorganic polymer is the endogenous factor Roman 12 activator in vivo. Platelet polyphosphate-driven factor Roman 12 activation provides the link from primary hemostasis formation of a platelet plug to secondary hemostasis fibrin meshwork formation. Genetics: the gene for factor Roman 12 is located on the tip of the long arm of the fifth chromosome, 533 Q. Role in disease. History: Hageman factor was first discovered in 1955 when a routine preoperative blood sample of the 37-year-old railroad brakeman John Hageman, 1918, was found. Hageman was then examined by hematologist Oscar Ratnoff, who found that Hageman lacked a previously unidentified clotting factor. Ratnoff later found that the Hageman factor deficiency is an autosomal recessive disorder after examining several related people who had the deficiency. Paradoxically, pulmonary embolism contributed to Hageman's death after an occupational accident in 1968. Since then, case studies and clinical studies identified an association between thrombosis and factor Roman 12 deficiency. Hepatocytes express blood coagulation factor Roman 12, currently produced quick clot products, produced and marketed primarily for use in battlefield medicine to treat penetrating trauma such as gunshot wounds and stab wounds and other injuries that are known to commonly cause exsanguination, such as blast injury, are used with the overarching goal of increasing. The purpose of increasing this time is so that the patient may reaching a higher level of medical care before succumbing from their injuries. These products use a kaolinite-based coating applied to the bandages by the manufacturer before packaging and sale. This coating, when applied to an open wound via the application of the bandages, directly promotes blood clotting by activating factor Roman 12 in the coagulation cascade. Also, due to the active ingredient nature of kaolinite, the activation of the factor Roman 12 occurs in both an earlier amount of time than it otherwise would. This coating is widely considered amongst combat medics to be vastly superior to the older quick clot powder formulation, which was poured into wounds due to the fact that the older formulation used bead form zeolite, a mineral which promotes the coagulation cascade due to the fact that the reaction between the zeolite powder and the blood inside the wound site was an exothermic one. This obviously caused extreme pain to the patient, often more so than the initial injury was causing them at the time, assuming the patient was still conscious at the time of the application of the powder. This effect is often seen in movies and TV programs, with the quick clot powder being poured into wounds, and the patient screaming out in pain as their wounds were violently burned on the inside surface of the wounds. This created a common misconception, which persists to this day, that commonly used quick clot products still use this method of clot promotion zeolite powder to this day. However, zeolite-based clotting products are no longer widely used by militaries and police departments throughout the Western world, as they have been widely supplanted by the kaolinite-based bandage products, which do not cause any exothermic reaction whatsoever, nor do they have the absolute requirement of the application of the product exclusively to the inside surface of the wound.